Hey guys, my name is Ricardo.
My name is Catherine Aguilar and I am from Group 1.
My name is Marvel Sherelle Bowden. I am part of Group 1, and our group chose to do the disease AIDS for our group final project.
AIDS for AIDS first symptoms. There's nothing special to it. You will more likely feel that you have a bad flu. There's going to be a lot of muscle pain, upset stomach, headaches, fever, sore throat, body rash, joint ache. It's just a really bad flu. But from the next 10, 15 years, you won't feel a lot of changes on your body. You will feel like you have a normal life. You can still play soccer, read book, go out. You will have the same normal life. But inside your body, the virus will still be in there. The virus will have three things: will infect new cells, will make copies of itself, and cause severe damage to your immune system. That being said, for the final symptoms that AIDS have will damage your immune system. It will damage it so bad that you will have really serious infections, you have really bad bacterial and fungal diseases. You will have a lot of weight loss, diarrhea, night sweat, fever, cough. You have skin and mouth problems, regular infections, and serious illness and diseases. All that will really get affected because say you don't have no more immune system. Your immune system will be shut down, so you won't have anything else to contradict all diseases.
HIV was mostly known within the early 1980s. There were a couple drugs that were recommended by doctors for the person to consume in order to reduce the spreading of HIV to replicate. And the sooner you would take it, it will have a high chance of reducing it. And there were also times within the female having pregnancy. The babies were born to have HIV, but they will also receive HIV medicine within the 4 to 6 weeks. And the less HIV spreading that the female has, there's a high chance for the baby to also have it reduced sooner and quicker as possible. There are preventions for HIV to be transmitted, and there are protection within sexual intercourse. The sharing of needles should not be allowed, or there also, whenever there's symptoms, there's also prescriptions from your doctor for you to take. Even if you do not have HIV, it's best to just get tested and make sure that you get prescriptions from your doctor. As I've said before, there are a few drugs, prescriptions, or treatments for the person to consume and take. And one of the treatment is the antiretroviral therapy, which consists with certain medication that can help from being detected in the blood test, and it works from slowing down the virus from duplicating. It also has more combination in the drugs than the rest of other treatments. It has almost about 3 combinations of each prescriptions, which there will be a few symptoms with each treatment that a person gets. Another treatment is the nucleoside reverse transcript inhibitor, and that is basically RNA turning back into DNA. It reverses just the block of infection of new cells of HIV, and it will have other combinations of other drugs. Another action of treatment is the fusion inhibitor. It's a drug that acts against HIV by preventing the virus from fusing with the inside of the cell and it preventing from replicating. It basically acts by binding to the envelope protein and blocking the structural changes. The prognosis for HIV is usually of how long a person will live up to, and usually without treatment, a person could live up to 10 years at max, or even shorter life expectancy. And it really depends on how high the HIV is within their system. With treatment, they really have a high chance on living a longer life. It really doesn't ruin the person for with having HIV. It's just, consistency of taking medications and making the virus going lower and lower each time. The lower it gets, the more high rate they will live up to. And usually it did take almost, Continental in 2018, there was almost 40 million of persons or each individual with HIV. It was about 79% of individuals who were knowledgeable of HIV, and about 69 roughly with treatment. Sometimes there will be treatments for each person, but it really depends on them within it. They really want to do those treatments just because it can be a little bit tough on them, but it's for their benefit.
Where did HIV come from? So scientists identified a chimpanzee in Africa as the source. They said that chimpanzee carried the simian immunodeficiency disease, which was later mutated into HIV. The version found HIV-1. Honestly, it was in 1959 where there was a man who had infected blood in Congo, and that was really the first known case. And it was later in the late 70s and early 80s, 1979 through 1981, where doctors began seeing cases of pneumonia, cancer, and other illnesses. But there were rare cases in Los Angeles and New York with men of homosexual preference. Acquired immunodeficiency syndrome, AIDS, is a chronic, potentially life-threatening disease that is caused by the human immunodeficiency virus, HIV. It has 5 predominant methods of transmission, which include unprotected sex between men, unprotected heterosexual sex, injection drug use, unsafe blood-to-blood byproducts, and mother-to-child spreading during pregnancy, delivery, or breastfeeding. In 1982, public health officials began using the term acquired immunodeficiency syndrome, or AIDS. They began tracking the virus in that year. By 1983, they had the first name HTLV-3 or LAV, which is a human T-cell lymphotropic virus, which was later coined HIV for later stages. The HIV life cycle is like many other viruses, where the infection begins with a viral and attaches to a host cell. Viral entry into the host cell is assisted by the viral proteins. Once the virus enters the host cell, it loses its capsid proteins by the process known as encoding. The viral nucleic acid is then available for replication. In most instances, the viral DNA or RNA is replicated and then transcribed into mRNA. CCR5 and CXCR4 are the 2 major co-receptors used in HIV-1. HIV is an RNA retrovirus. The risk of contraction. The estimated per exposure risk of HIV transmission is as follows. Receptive anal intercourse is 1 to 30%. Insertive anal or receptive vaginal intercourse is 0.1 to 10%. Insertive vaginal intercourse is 0.1 to 1%. Injection drug use with needle sharing is 0.67 per needle sharing contact. How HIV kills. HIV enters the bloodstream and seeks out the T helper cells. These cells help to regulate the immune response to disease-causing bacteria or virus. When the virus infects the T helper cells, the cells send signal to other cells, which produce antibodies. Antibodies are proteins made by the immune system in response to an infection. So the T helper cells may not also be called T4 or CD4 cells. When our immune system is working correctly, it protects against these foreign invaders. HIV infects and destroys the T helper cells and damages their ability to signal for antibody production. This results in the eventual decline of our immune system, leaving our body susceptible to all type of illnesses and death. Death by AIDS is notably most often due to a virus infection that our body's immune system could not suppress. Last part of my presentation will be on current research. I was able to locate articles that state that women are more susceptible to AIDS than men. Women account for more than half of the number of people living with HIV worldwide, and young women 10 to 24 years old are twice as likely to acquire HIV as young men the same age. And that is usually due to health resources, to financial status, and the research put into women. The second current research articles that I was able to find are that there is in fact a cure for AIDS. Timothy Ray Brown was the first person to be cured of the human immunodeficiency disease, HIV, over a decade ago, and it was thought to be habstantial. But there is a second patient, the London patient, who has been now successfully in remission for 18 months. They both had in common was a bone marrow transplant, and because they had cancer, they had a blood cancer.
For the current research, I did find a little bit of information in this article where it did involve a study of a few group of people. It was roughly about 48 men and 48 women. They were tested to test their knowledge towards HIV, and mostly it did came with low percentage of them knowing. There were a few, like mostly half of them. Probably was 26% of outpatients that had poor knowledge of it. And then people that were moderate with the knowledge, it was roughly 14% with the knowledge. And usually they did mention that a few people were very ignorant when it came to trying to acknowledge what this disease was. They usually would explain that there were treatments for it, but the person that was very ignorant, they would roughly just try to avoid it rather than to deal with the situation. They rather just keep on going instead of getting better. And it was usually just organized by just testing each one on how they were within the whole situation. And when I did see the peer reviewed of the scientific articles, they did kind of organize them in very structured ways, mostly involved with showing the abstract and also going within the introduction, showing more information of the entire article, slowly cutting it all into pieces and explaining how each situation runs with which. And then also they kind of went into topic of, okay, we did this in this situation of the program, and this is the, results. That's what I realized whenever I was reading the articles and how they were peer reviewed.